Hello again. Today's module delves into the realm of clear aligner attachments utilized alongside the BClear aligner system. We will unravel the underlying biomechanics, the contrasting force dynamics, and delve deep into the various types of attachments, understanding their purpose and application. We'll also touch upon best practices for placement, ensuring optimum results. So, let's embark on this enlightening journey together. Let's embark on our journey by understanding the biomechanics foundational to the BClear aligner system. Essence of biomechanics and orthodontics. The crux of orthodontics lies in the strategic manipulation of tooth positions through biomechanical forces. Whether it's traditional braces or modern aligners, these devices harness biomechanical principles to achieve the desired tooth movements in both a safe and efficient manner. Force dynamics, push force mastery, a distinguishing trait of aligners, and particularly BClear aligners, is the employment of a push force dynamic. This contrasts sharply with traditional braces that predominantly use pull force. This push mechanism is central to the efficacy of clear aligner therapy. As we delve deeper in subsequent slides, understanding this contrast in force application becomes paramount to mastering aligner-based treatments. Clear's innovative three-layer structure, setting BClear aligners apart, is their state-of-the-art three-layer design. More than just providing durability, this design optimizes the force application. This structure bestows our aligners with an unparalleled ability to rebound from mechanical deformation, ensuring they consistently deliver superior teeth movement force, often outpacing many competitors throughout the prescribed wear period. The orthodontic realm has two major force players, push and pull. BClear aligners primarily utilize a pushing mechanism. Imagine nudging a door open with your hand. In contrast, traditional braces, with their brackets and wires, grip onto teeth, pulling them into their desired locations. Both forces have their advantages, but today's focus will be on the pushing magic of aligners. Let's delve deeper into the principle behind attachments. They're essentially biomechanical amplifiers. What does this mean? Attachments increase the efficiency of the force exerted by the aligner, giving a more predictable movement. Imagine trying to move a heavy box on the floor. While you can push it directly, adding a handle or a lever amplifies your effort, making the task easier and more controlled. Similarly, while aligners can move teeth by direct contact, some movements, especially complex ones, require a better grip or a specific force direction. This is where attachments come in. They act as these handles, ensuring the force from the aligner is directed effectively, resulting in the desired tooth movement. It's like giving the aligner a tool to work more proficiently in specific scenarios. Tooth movement in orthodontic treatments requires precision and control. Attachments, specifically designed for this purpose, enhance the grip on individual teeth, making specific rotations and shifts possible. They serve as critical tools that guide teeth in the desired direction, ensuring consistent and predictable outcomes. The design of attachments and their strategic positioning on teeth are fundamental for the success of complex treatments. Orthodontic challenges constantly evolve, and so do the tools we use. One innovative tool in our orthodontic arsenal is the beveled attachment, and it's a game-changer in aligner therapy. Traditional attachments, while effective, often come with perpendicular edges. While these edges can grip aligners, there's a limitation. If the aligner isn't seated perfectly over these edges, teeth might not track correctly, or worse, they could move in undesired directions. Beveled attachments come to the rescue here. Their design, with edges that are angled greater than 90 degrees, offers a more forgiving seating for aligners. This means even if the aligner doesn't perfectly overlap the attachment's peak, it can still seat correctly, ensuring consistent tooth movement. Moreover, these attachments are versatile. Their unique design allows them to aid in a variety of movements, be it extrusion, where teeth are pulled outward, torque adjustments, or even intricate rotations. The beveled edge design aids in distributing force more evenly and provides a better grip, ensuring precision in every move. In a nutshell, beveled attachments are akin to refined tools, sculpting teeth movements with increased finesse, predictability, and control. Within the vast realm of orthodontics, the precision with which we move teeth is pivotal. Vertical and horizontal attachments serve specialized purposes in achieving this precision. Let's dive deeper. First, we have the vertical attachments. These primarily aid in mesiodistal movements. Think of the tooth shifting either towards the front or the back of the mouth. Moreover, vertical attachments can assist with intrusions or extrusions, that's moving the tooth up into the bone or pulling it out. On the other hand, horizontal attachments are predominantly designed to manage buccolingual movements. This refers to the tooth moving either towards the cheek, buccal, or towards the tongue, lingual. Additionally, these attachments play a role in controlling torque, which is the inward or outward rotation of the tooth, as well as facilitating tipping movements, where the crown of the tooth tilts but the root remains relatively stationary. In essence, by using these attachments strategically, orthodontists can exert specific forces on teeth, ensuring each tooth moves in the desired direction and manner, maintaining oral harmony and achieving the perfect smile. Rotational movements in orthodontics represent a distinct challenge, particularly for certain teeth shapes. Enter rotation attachments, designed to address these very challenges. Rotations in dentistry refer to movements around the long axis of the tooth. Now, certain teeth, notably canines and some premolars, possess a conical shape. This shape, while aesthetically pleasing, offers less surface for aligners to grip onto, especially when trying to induce a rotational movement. Rotation attachments, strategically positioned on the buccal or labial surface of the tooth, serve as an additional surface for the aligner to push against. Parallel to the tooth's vertical axis, they amplify the aligner's force, ensuring a more effective and predictable rotation. But there's more nuance here. Depending on the tooth's positioning and the desired movement, these attachments can assist in both buccolingual and mesiodistal rotational adjustments, ensuring that the tooth not only rotates but does so in the intended direction. In essence, rotation attachments are like giving the aligner an extra grip or lever, specifically tailored for those tricky rotational maneuvers, ensuring that each tooth aligns harmoniously with its neighbors. In the world of orthodontics, simplicity is often a luxury. Some teeth require movements that are not just in one plane but multiple. This is where multiplane attachments shine, offering solutions for such complex scenarios. Imagine a tooth that needs to be both rotated and extruded simultaneously. Traditional attachments might cater to one movement effectively, but combining them can be a challenge. Multiplane attachments, as their name suggests, are designed to facilitate movement in more than one plane at the same time. Positioned carefully on a tooth, a multiplane attachment has surfaces that allow the aligner to exert forces in varied directions concurrently. This means, while one part of the attachment aids in rotating the tooth, another part might be helping it extrude or intrude. It's this synchronized action that makes these attachments invaluable for certain cases. In essence, multiplane attachments can be visualized as sophisticated orthodontic multitaskers. They handle complex, combined movements, ensuring that every shift of the tooth aligns perfectly with the treatment plan, bringing closer the vision of that ideal smile. The realm of orthodontics isn't just about moving the visible parts of our teeth, it's equally about the hidden parts, the roots. Ensuring that roots move as intended is vital for the stability and longevity of orthodontic outcomes. Here, the optimized root control attachments play a pivotal role. While the crown of a tooth might move easily, ensuring the root follows the desired path can be challenging. Without precise control, you might see unwanted tipping or torque, where the tooth's crown moves but the root doesn't align properly, possibly leading to future complications. Optimized root control attachments are specially designed to address this challenge. They offer a grip that allows aligners to exert forces directly impacting the root's movement. This ensures that as the crown shifts, the root moves harmoniously with it, maintaining the desired angle and position. To put it simply, these attachments act as precise guides, ensuring that every part of the tooth, from the visible crown to the hidden root, moves in sync. They're the backstage heroes, ensuring the spotlighted results, the visible teeth alignments, are stable and lasting. Placing attachments is a meticulous procedure that requires precision for optimal outcomes. Let's delve into each step to ensure a clear understanding. Tooth preparation. Start by cleaning the specific tooth or teeth that will receive the attachment. This involves removing any debris and ensuring the surface is clean. Then, etch the tooth surface to create microabrasions, which will aid in the strong bonding of the attachment material. Template fitting. Before applying any material, fit the provided template to ensure it sits perfectly on the teeth. This template will guide the precise placement of the attachment. Composite application. Once the tooth is prepped and the template fits well, apply a small amount of dental composite material into the attachment pockets on the template. Remember, it's crucial to slightly overfill, but avoid excess, as this could result in unnecessary cleanup later. Template seating and curing. Place the template back onto the patient's teeth and ensure it's firmly seated. The composite material inside the template pockets should be in direct contact with the tooth surface. Once seated, cure the composite using a dental curing light as per the manufacturer's instructions, solidifying the attachment onto the tooth. Excess material removal. After curing, there may be some excess material or flash around the attachment. Carefully remove this using a dental scaler or a fine dental burr to ensure the attachment is neat and won't interfere with aligner placement. Final verification and polishing. Check the attachment to ensure it's securely bonded to the tooth and doesn't have any sharp edges. If needed, polish the attachment slightly to ensure a smooth surface. Proper attachment placement is both an art and a science, demanding precision for the best results. To ensure effectiveness and durability of these attachments, here are some key tips to consider. Consistent tooth preparation. The foundation for any procedure lies in its preparation. Always ensure the tooth is clean, free from debris, and etched consistently to provide an ideal bonding surface. This not only helps in better adhesion but ensures the longevity of the attachment. Gentle template handling. The provided template is a guide for precision. Handle it with care to avoid any warping or damage. A perfect fit template ensures the attachment aligns perfectly with the treatment plan. Composite material mastery. Familiarize yourself with the dental composite's properties. Know its working time, consistency, and curing requirements. Proper handling ensures optimal bonding and reduces chances of attachment failure. Prevent overfill and underfill. Striking a balance is key. While it's important to ensure the attachment pocket is filled, excessive material can cause unwanted flash, and too little can result in weak attachments. Aim for a slight overfill and then meticulously remove any excess. Regular patient feedback. Always encourage patients to provide feedback after attachment placement. They can offer insights on comfort, any sharp edges, or if they feel any detachment. This proactive approach can address potential issues early on. Periodic attachment inspection. During regular checkups, inspect the attachments for any signs of wear, detachment, or damage. Regular inspection ensures any issues are addressed promptly, ensuring treatment stays on track.